I think a bright future for psychiatry will require much change. In rural Newfoundland in particular, it will require considerable energy directed towards recruitment and retention, but I see many other solutions, including innovations, electronic medical records, telepsychiatry, supporting and facilitating more appropriate collaboration between the healthcare professionals, including physicians and in particular nursing. I recently personally hired a nurse in my practice, and this has been a way to help my patients to navigate a system and find care. There are many barriers that prevent psychiatrists from working the way that we would like to work. As Dr. St. John has alluded to, we often are providing the services, we're filling other gaps in the system. We're not acting as psychiatrists, we're acting as family physicians or mental health workers. So we need to help psychiatrists focus on what they do best. We need to be focusing on new assessments, on consultations, on directing care, and then having a system that will help deliver the care as we've outlined. So to solve the problem, we must first stop ignoring the problem. On the front lines, we are breaking under a burden of intense need. I'm asking for attention and innovation in supporting physicians to care for more patients and help to recruit more physicians to this profoundly underserviced area.
So if anyone has any questions, the panel will fend them.
This is an area that the public has been aware of for some time, that there are issues within psychiatry. I guess the question, and any of you can answer this, is why does it take a labor dispute for the public to hear these stories today about the situation that's existing out there? Because we have known for some time, and it is a difficult area to get people to speak on, but you're the physicians. Why hasn't this kind of advocating gone on? You know, some has, but why hasn't more of it happened in the past?
If I could speak to that briefly. As I said, it's very much a struggle. If you're sitting on a wait list and you are aware that it's going to take some time to get care, I'm very cautious about trying to communicate to the public how desperate the situation may be to access care. So I think part of this is we have been trying to work internally and to work in a way that is going to be productive and allow progress on these issues. And therefore, you know, we've tried not to bring these issues directly to the public to cause more fear. But at this point, we feel that this is one of the ways that we can help highlight how the system needs to change.
As well, I mean, I think that obviously we've known about the problems for quite some time, but I think because of the chronic shortages that we've had, we've practiced Bandaid medicine in many different areas, not just psychiatry, but particularly in psychiatry. I graduated 3 years ago, and I can remember in my negotiations of trying to find a position for myself, of telling the powers that be, there's no long-term vision here for mental health in our province, and I think that's because we've been working on Band-Aid solutions for so long. What is the most acute problem? Where is the biggest crisis? Let's fix that, and then we'll see if we have any time, energy, or money left over to deal with the rest of it. So I think, as Dr. Luscombe has said, that we've tried to work through this, inherently. We've tried to work within our group. We've brought these issues before to administrators and to government officials, but we're still in the situation that we're in.
I guess it's also that old story where when you're downstream pulling people out as they're drowning, it's really hard to run upstream to find out who's throwing them in. And I think for a lot of us, we spend so much time advocating on an individual basis for our patients that at the end of the day, we're advocated out on the bigger sense. Yeah. Many of us spend hours on the phone trying to deal with housing issues, with getting medications approved, with getting a support service, with trying to get in my case, a pediatric colleague to see a child that has asthma because they don't have a family doctor, and I've been prescribing the medication for the last year because that's what the last doctor put them on, and now they need to be seen again. Those are the kinds of things, and we're spending so much time and energy doing that on an individual basis. We've probably neglected on a much larger basis to do that.
Government announced last year that it would build 2 different facilities, one for children with complex mental health needs and another one addictions. And I guess that one was slated to go to Central Newfoundland. But even in the most recent budget, we've only seen like $5 million allocated over, I believe it's 3 years for those facilities. And the response at the time was, the government action at the time was in response to what they call the critical problem. What do you make of the fact that the progress on these 2 facilities that could possibly alleviate some of what you're talking about today is so slow?
It's discouraging on the one hand, because I think that there is a huge need, but again, it's somewhat reactive, and it's going to service a very small number of the population. And again, they are high users, they are high risk, but it's not going to solve the problems of the vast majority of people out there with mental health issues. It's discouraging that it's so slow, and again, I believe, was fairly reactive at the time, and that with more consultation amongst providers, there may have been other places that money could have been better spent.
I would add to Dr. St. John's comment that, again, if you really think about the needs, when you consider this as being so prevalent, you know, the family physicians are often forgotten as a very significant contributor to mental health care services. And one of the things I would strongly advocate for is how do we help family physicians to have the resources they need, because they are very much carrying a big part of this burden.
And to have these facilities, you know, on paper is a good thing, but as we've also pointed out, there's a chronic shortage of allied health, mental health professionals in addition to psychiatrists. And so while it's great to have a building, who's going to work in these buildings? And who's going to train the people to work in these buildings, because they're very specialized services. So it's one thing to put up a building, but it's going to take a bit of time as well to get someone who's skilled and can provide adequate and appropriate services to these buildings.
So as a young graduate of 3 years, given everything you laid out, what in the world would have enticed you to stay here to practice?
My husband asks me that every day when I go home, and my husband is not in medicine, and he says, why are we here, and why aren't we moving, and we could go somewhere else, and you could feel respected, because on many days I come home and I don't, and he said, and you could make more money. And you know, we're both from here. My husband and I are both rural Newfoundlanders. I trained here. I chose to stay here because the province is home. I enjoy the patients. I enjoy the people. My family are here. I have a 10-month-old who I would be taking from her family if I was to leave. Right now, those are my reasons for staying. Whether those will be enough reasons to keep me here at the end of the day, because whether or not, you know, I can't tell you how long that I'll be able to stay here, feeling, as Dr. St. John said, advocated out at the end of the day, that you can't advocate for anyone else, or just feeling that the service you provide compared to other services is just not being valued.
Several years ago, we had an inquiry into mental health services, and anyone who participated in that, I mean, it was heartbreaking, some of the testimony from professionals and people involved about the access to services in rural areas. Just wondering if you make a comment on how you feel, how much your expertise is on that inquiry, but how you feel things have progressed since then, because it doesn't sound like it has progressed a whole lot.
I think there has been some progress. I mean, you know, we have new mental health legislation, which I guess came in effect in 2008, and that has really allowed us to intervene earlier as cases become severe and may have risks. Also tied to that legislation, there has been resources for what we call ACT teams, which is Assertive Community Treatment Teams. And these are 24/7-hour services that can go into the community and respond to a crisis. There are I guess I know in my region, so we have one in central Newfoundland, definitely steps in the right direction. That's good if you live in Grand Falls or maybe even in Gander, but you still got to wonder, so who's going to serve the person in Bay Verte? Who's going to serve the person in Glovertown? So the nice thing is that, you know, we've definitely had progress, but there's still, and this is where I see, you know, considerations around linkages maybe with family medicine. How do we organize this system much better so the care providers that are on site can really do as much as possible?